I'm gonna bring up my Facebook page and see if I see you live here.
And it's a little delayed.
Oh, that's good. So it gives you like a little warning.
Hmm.
Oh, wait, this meeting is being live streamed. Okay. Okay.
Are we on?
I'm looking. I'm looking.
Look, there's one person watching.
Is it me? No, just kidding.
Probably. Okay. Hi, everybody. Welcome to the very first Serdentity podcast. And my name is Elizabeth Dewar Anthony. And my beautiful guest today is Miss Becca Rose. She is an orofacial myofunctional therapist and a retired dental hygienist. And she owns Myofunctional Pathways, which is located in where?
Oostburg, Wisconsin.
Woohoo! Wisconsin is a fine state.
It is.
All
Love it.
right. So I want to talk to, I've known Becca for a couple years, and I know that she is a Buteyko instructor. And you also were a Buteyko patient, right? I mean, you did the program yourself, and then you became an instructor. Is that right?
Yeah, I had an interest in it when I first learned about it and I was learning Myo with my first mentor. And I did the Buteyko program myself and it really changed my life. I was an insomniac my whole life, couldn't sleep. So when I did the Buteyko and I saw all the effects that it gave me personally, I was in love. I'm like, I need to do more of this and I need to help people learn how to do this. So that's really where it came from.
That's amazing. Tell me more about the benefits.
Oh gosh, there's so many. Um, Anxiety really is a big one. Rest and digest, that fight or flight nervous system versus our rest and digest. People with asthma can have benefits from Buteyko. Sleep quality is huge. It's really nice because it also talks a little bit about oral rest posture and some of the things that we teach people in myofunctional therapy. But really, for me personally, the two biggest things I got from it was sleeping, amazing, amazing sleep, and really just learning how to breathe out of my nose. That's really one of the biggest focuses of Buteyko breathing is nose breathing and then using your body's gases, your breathing gases to your most optimal benefits.
Wow. So, a lot of people think that they are nose breathers, but really hardly anybody is. And to breathe through your nose, modern humans, they have to go through what you went through, which is this whole Buteyko, it's training, right?
It really is. It's not as intense as like some training we think of, right? When you think of, I'm going to train for something, we think of this like really high intense. It is intense in the sense that it takes some time and practice. But really, what I had sinus surgery 5 years ago or so, and I had nasal turbinate reduction. So, if you don't know what turbinates are, they're the bony structures inside the nose. I had my
Mm-hmm.
tonsils out when I was 28 years old. So, I've had a lifetime of sinus and tonsils and allergies, horrible. And even after
Wow.
I had surgery, nobody told me you need to breathe out of your nose. I didn't even know that was a thing until I learned about this world. And oftentimes, when you're talking with people and you ask them about mouth breathing, they're sitting there, you're talking, and their mouth is actually open.
Yeah, like this.
Yeah. And you're talking about, so when you're talking about maybe your child, are you observing mouth breathing in your children, your child? What about you? Do you feel like and their mouth is literally open when you're asking about this? And they're like, nope, nope, no,
Nope.
no, I don't know. It's breathe. What are you talking? Or I don't mouth breathe. What are you talking about? It's like your mouth is literally open right this second. Like, and then they're like,
Right.
oh, oh, oh. And then I tell people, I'm like, maybe just go home and actually just think about it a little bit. Pay a little bit of attention. And if you're like me, you're going to realize that your mouth is open way more than you ever realized it was.
Mm-hmm. And people get like insulted when you imply that their child is a mouth breather. Um, it's like they take it personally. It's like, look, it's not a moral failing. Okay, this is this is just the nature of it's, I call it the modern human conundrum because so many of us haven't, we don't, life is so easy for modern humans compared to, you know, prehistoric humans. And it's easy to survive breathing through your mouth. And because of our smushed back faces, right? The tongue is back in the airway, and it's plugging the. Even if you clear your nose out in the front, like you had the turbinate reduction, you had all kinds of surgery, but you still couldn't breathe or didn't breathe with your nose because you didn't hadn't acquired the habit, right?
Right. I didn't even know that was a thing.
Mm-hmm.
I just breathed like I always did. Yeah, it's a habit. You have to learn it if you've never done it regularly, just like anything else.
You know, you know, I've been in the myofunctional world for now 6 years, and I find myself all the time like my mouth is just hanging open, and
What?
at least I'm aware today. At least I have some awareness. Um, but what I wanted to talk to you today about was breathing and the airway in terms of the patients, dental patients. Um, I understand now. So I've been talking about dental fear and dental trauma for 20 years. And it wasn't until I started learning about orofacial myofunctional therapy that I realized that, oh my gosh, a lot of these behaviors are related to airway protection. I had already figured out prior to that that a lot of patients who present in ways that are not pleasant, right? Hostile, belligerent, angry. A lot of those patients are fearful, and that presenting behavior is a defense. So I had already figured that part out. But the very first day of my first AOMT course, like in 15 minutes, the first 15 minutes of that course, I was like, oh my God, I get it. I was like, it's the airway. That is the initial trauma. Wowie wow. So since then, I've, been trying to amp up my message to my fellow dental professionals who a lot of people seem so miserable. They're complaining in Facebook groups. They're complaining about these rude patients. And I want them to understand that, a lot of these people that have these behaviors that annoy us, they, the patient is not aware that they're doing it. And what they're trying to do is survive. In order to survive, you have to breathe.
Yeah.
So, airway has become a buzz phrase in the dental profession, and everyone's like, oh yeah, airway. But what does that mean? Us dental people, you're working in the airway, whether or not, you use it as a marketing term, you're working in the airway.
Right.
So that's why it's so important for dental professionals to understand.
Yeah.
What do you think?
All right. So I completely agree with everything that you've said. And I am guilty as charged. I have been, when I was working active hygiene, yeah, I mean, you always think about those patients where their tongue is so huge, right? And it's in your way, it's in my way. My mirror can't pull it away, or the cheeks, you're getting those lips tight around your mirror and you just can't retract. You can't see what you're doing. And it's not until you learn about the airway, the myofunctional, the muscles, all the things that are happening where your light bulb goes off, and it's like, and then you feel guilty because, like, how did I feel that way about my patients, And it wasn't with bad intent, or it wasn't with malicious. It wasn't malicious.
Mm-hmm.
It's like, okay, my shoulders hurt, my back hurts, my elbow hurts, my thumb hurts, and now I have to work this much harder to pull your cheek away or pull your tongue away. So it's really not even about the patient. We have the dental, we have that side effect of it too, but
Right.
and then our airway is probably going crazy because we're
Oh,
like,
right.
no. But anyway, so when it comes to the patient in the chair, you know, we're looking, you see those scalloping marks on the tongue, right? And that's one of those airway buzzwords, if you will, the scalloping that is indicating, your tongue can't fit in the palate very well, so the upper jaw is too narrow. Um, Gag reflex, that's probably the biggest one. And you're right, I tell my clients all the time, your gag reflex is supposed to be there. It keeps
Mm-hmm.
you alive. It literally keeps you alive. That's its job. It's supposed to be there. And when clients are coming for, services that we provide through myofunctional therapy, they don't realize that this can help their gag reflex either.
Mm-hmm.
Um, we really have to learn how to breathe out of the nose. And that sounds so easy. It just close your mouth and breathe out of your nose. But as I know, and as you know, it's not that easy. And sometimes you actually have to teach someone how to do that. And there's other structural and muscular, soft tissue things to take into account with that as well. But the thing is with the gag reflex is that, like I said, it's supposed to be there. You don't want it to go away. It's supposed to save your life. It protects your airway, but it shouldn't be so sensitive that if you just even start to put something in your teeth, you start to gag. That's not
Mm-hmm.
normal. That's an airway defense mechanism, right? You're trying to keep
Exactly.
yourself alive, and your body is sensing, uh, um, what's the word I'm thinking of? It's sensing a danger, right?
Mm-hmm.
And it reflexes, you get that gag reflex.
Yep.
It is almost, so this is where we kind of like bring in the nasal breathing part with the mouth breathing and the gagging. It's almost physiologically nearly impossible. I'm not going to say impossible because it's nearly impossible to actually gag unless there's air actually entering your mouth.
Mm-hmm.
So if you're breathing correctly through your nose and your tongue is able to make the correct connections in the mouth with the roof of the mouth, and you're not breathing through your mouth, the gag reflex is hardly achievable.
Mm-hmm.
That's a real big thing that I'll talk about with clients as well. But
Mm-hmm.
when we can get that nose breathing under control, your tongue goes up to the roof of the mouth, and then you can use your own body to help control your fear and your anxiety and protect your airway.
That is exactly right. And so many patients have been made to feel really ashamed of this gag response. And, my first instructions to them are, look, this is a reflex. You can't help it. Okay. You're not a bad dental patient. This is your brain protecting your airway. Your brain doesn't care, okay, how much you need these x-rays. Your brain doesn't care how nice this office is. Your brain doesn't care, like, any of that stuff that, it's the greatest technology ever and blah blah blah, and I have all this training. The brain doesn't care. Okay, the brain is going to breathe, and if your mouth is how you breathe, your brain's like, nope, not happening. And so I put something in the mouth that blocks the airway, the brain's like, nope, out it goes.
Yeah.
So that's the first thing I love to inform patients is this is a reflex. I understand you are not doing this on purpose. And I'm telling you right away, that brings down a lot of that defense. When patients come in and they're all, they're expecting a fight, when I can provide them with a little bit of information and a little bit of, compassion, it brings that response down instead of bringing it up. you know, a patient will come in, it's Mrs. Jones, you're due for your x-rays. And Mrs. Jones says, well, I don't want the x-rays. And, so then I get in an argument with Mrs. Jones about, and I'm throwing around terms like standard of care, blah, blah, blah. And meanwhile, Mrs. Jones is getting more and more defensive. But the real issue is that Mrs. Jones can't breathe. So if I step back and say, listen, I looked at your previous x-rays and I can tell that you have a hard time with dental x-rays, and I'm going to get you through this. And it's like, bam, like, and the patient, 9 times out of 10, their attitude changes.
Yeah, because finally someone is empathizing with them instead of arguing with them. It's like,
Yes, empathizing with them instead of arguing with them. I love it. I love it. I love it.
yeah. And sometimes we forget to put ourselves, so we're also dental patients because we go and have our teeth cleaned and we maybe need a crown or a filling. But we because we know the environment so well, we forget from the patient's perspective.
Mhm.
So really having that empathy and that, maybe we step back and we remember a time that maybe we were experienced a traumatizing experience at a medical office. Not that we want
Mhm.
to relive those things, but it helps us to remember, hey, this is our job every day. We're coming here and we have our job frustrations, but we can't ever forget that there's a real person sitting in
Mhm.
that chair with real trauma and real life fears and real life airway issues.
Absolutely. And, trauma informed care is another kind of a buzz phrase that's going around in the healthcare professions. And it's about, understanding that this person has been traumatized and approaching them from a point of view that acknowledges that. And it doesn't mean you have to like talk about it nonstop, but it's a mindset for me. I'm approaching this person with with, like you talked about, some empathy.
It makes all the difference. You're right. Their whole attitude, their whole body language, their facial expression, their ease, everything changes when you just put yourself in their shoes for just that moment to reassure them that this is going to be okay. You're going to get through this.
Hmm. I had a 75-year-old woman who had carried this shame all her life. And she says, I know I'm a bad dental patient. I said, look, you are not a bad dental patient. You're trying to breathe. And I came up with, she was one of the first patients I tried this with, a breath coaching x-ray technique. So I said, okay, I want you to breathe in and out through your nose for a little bit. And I had to like listen to her nose. I'm like, can you breathe through your nose? And she could. So I said, I want you to breathe in and out through your nose for a little bit. Okay. Now, and I picked up the sensor. I said, okay, now I want you to take a deep breath in through your nose and hold it. Now open your mouth. I placed the sensor. I ran out, pushed the button. I said, now you can let your breath out. And she let her breath out. I grabbed out the sensor and I said, okay, that's good. We got it. And she couldn't believe it. She couldn't believe it. She's like, what? We got it? I'm like, yeah, look at it. It's right there in the screen. She's like, oh my God. She cried. She cried. She couldn't believe that it was possible to have a dental x-ray taken and not feel like she was going to die.
Yeah. I'm trying
So,
something while you talk.
yeah. And
Yeah. Let's do
I,
it with somebody
yeah,
right now.
I figured that out with her. And now, and that's what I do for all my patients that, present with a gag reflex. And you can, if you look at a patient's, you can be proactive about some of this stuff. When you see this person's name on the schedule, instead of like, feeling sorry for yourself that you have to see this jerk, why don't you look at their previous x-rays? When you see, a bite wing that's got a downward angle where they can't close, that's a really good indication that this person has a hard time with x-rays.
Yeah.
So you can know that in the back of your mind. And
And
how many times have you done this where you go to take an x-ray and the patient says they hate x-rays? And what do they have? They have huge tori in the bottom of their mouth.
yeah,
And that's all from, bruxism, which is all, again, it goes right back to the breath.
right.
The,
Yeah,
the brain is going to breathe
right.
no matter what. Why why would a body destroy part of itself except to survive? So why would we be breaking down our teeth with bruxism if not for survival?
Right.
Right? I tell patients all the time, you're not grinding your teeth on purpose because it's fun.
Right.
Okay. This is your brain trying to survive.
Right.
And animals don't chew off their own limbs, right, for fun. They do it if they're caught in a trap and they have to get away.
Right. Yeah.
So anyway, I sort of went off on a tangent there.
Yeah, that's cool. That's good.
um, but so talk to me more about what you do for people with their breathing.
So I want to make sure that my clients can breathe through their nose all the time. That's the goal of all of us, right? That are in this side of airway and dentistry. Really, it starts first with the education. I have to figure out what are your goals, what are your symptoms. And based on that, I really personalize everything to each case because every person is so unique and different. Their muscles work different, their tongue is different, their shape, their jaws, everything is different. So you can't just do the same thing with every person. Well, when it comes to myo, but as far as breathing, that's a little bit more, I guess, not standardized, but
Mm-hmm.
really we have to bring awareness to getting the tongue up and then start breathing through the nose. And a lot of breathing techniques out there focus a lot on take really big breaths in and then really breathe out of your mouth. With the Buteyko breathing, it's the opposite. We're taking deep breaths by taking in less air. And then people look at me like, what the heck did you just say? Like,
Mm-hmm.
we're not going to do this big, huge breathing, but we're still going to get a deep breath because we're going to learn how to do some small breath holds after you actually exhale. So instead of taking a big breath in and holding it, I want you to exhale a little bit. Well, exhale and then hold your breath because that's giving your body the ability to balance the breathing gases. So we all hear about oxygen and carbon dioxide. There's another gas in our face that's created in our sinuses and our nasal cavities called nitric oxide. And
Mm-hmm.
all of these gases, and I never heard of that until
Right. I never heard of it either.
I never heard of that. But that gas is really responsible for reducing, bacterial load in the nose and viral load and allergy particles. And it dilates the nose and it helps us to get more air into our body and into our lungs. And then if we allow ourselves to hold our breath on that exhale and start getting used to a little bit of the carbon dioxide in our blood, that's when we really start to control that sympathetic versus parasympathetic nervous response. So that fight or flight versus rest or digest. That,
Mm-hmm.
I mean, we could talk about Buteyko for hours and all the different things that it helps with, but I really just want to focus it since we're talking about dental fear, just
Mm-hmm.
how to control some of the anxiety and the fear while you're in the dental office.
Mm-hmm.
So learning how to do that exhale and hold it. We need to have a certain amount of CO2 in our bloodstream in order for our body to function. We're taught that carbon dioxide is waste, right?
Yes. Yeah. It has a total bad rap.
I know. And I mean, it's partially true, but it's not all true. We need,
Right.
there's a reason they do CO2. I mean, they can test your CO2 levels with a blood test even, like, and then you use the SpO2 monitors for your blood oxygen, sense. So all the stuff, right? We need to have a certain amount of CO2 in our system for our body to go into rest and digest, for our digestive system to work properly. It allows so much dilation. And when we get
Mm-hmm.
dilation, things open, right? We get better blood
Mm-hmm.
flow to our brain, to our muscles, to our whole body. But really that, and then the vagal response too, that's associated with learning how to put the tongue in the right position on the roof of the mouth,
Mm-hmm.
incorporating that with nasal breathing. And when learned, you can really bring yourself from a high anxiety state to a relaxed and controlled state very quickly once you learn the techniques.
Mm-hmm.
It's incredible.
Well, and that vagus nerve, when you look at a map of the nerves in your body, the vagus nerve is right where we're working.
Yeah.
And that is such an important nerve, right? It's the only one that's bidirectional. And, you know, I have also coached people on sort of a vagus calming exercise where you breathe in through your nose and out with a hum.
Yeah.
Hmm.
Yep.
For the
I love
musicians
that.
out there, it's middle C. Middle C is a very calming note. But when you feel your lips vibrating, that's how you know that you're doing a good hum. Um, and that hum, you're doing two things. You're breathing out more than you're breathing in, and you're stimulating the back of your throat, which kind of is like a massage for the vagus nerve.
Right. And the other thing it's doing is when you add that humming component, you're increasing production of nitric oxide in the sinuses as well. So it's kind of
Wow.
like a threefold. You're activating or stimulating your vagus nerve. You
Mm-hmm.
are controlling your exhale, like you mentioned. You're having a longer exhale than an inhale, which brings us into parasympathetic. And then you're also allowing more nitric oxide to build in the sinuses and the nasal cavity. So when you take that breath in again through your nose, you're getting more of that gas and more of that dilation. And then the benefits of all of that together stacks and stacks and stacks over time.
That is amazing. I didn't even know that. Wow. I have to put that in my presentation. um, so wait, oh, well, I had some brilliant thought, but it just left me. So, we've been on here about a half an hour, and I think that's about the limit of most modern humans' attention. And this has been an awesome conversation, and you are brilliant.
You are
And
too.
so, any parting thoughts you want to get out there before we close?
I just want to thank you for inviting me to come on and talk to you today because this is a topic that really needs more awareness and more attention, not just in dentistry, but just in medicine in general. That, we just need to put ourselves in the patient's shoes and look at their perspective, where they're coming from, and realize that these people are not coming in to make our day hard. They are not coming in to cause trouble. They are coming in scared and they have anxiety. And part of what we should be helping them with is how to control that so that they can also have a good experience. So thank you very much.
You're entirely welcome. Have a beautiful rest of your day. And I look forward to seeing you soon.
Yeah, we'll see you soon.
All
Bye-bye.
right, hon. Bye bye.
Bye.